What we have seen in the morning is that people with chronic conditions, they face a number of additional challenges, and this applies particularly to those who have a rare disease, and this means that less than 5 people out of 10,000 people are affected by this, and there are 6,000 rare conditions. And in Germany, we have 4 million people suffering from rare diseases. So how can we provide qualified peer counseling and self-management for people with rare chronic diseases? Natalie Uhlenbusch works at the University Hospital Hamburg-Eppendorf, and I'm not sure whether she has all the 6,000 rare diseases in mind, but this is the target group that she is focusing on, and she will tell us more what peer-to-peer counseling means in this special context. Thank you very much for these warm words of welcome. I would like to thank you for having me. I'm delighted to be here, and I'd love to tell you about a research project that we carried out at the University of Hamburg between 2016 and 2021, and it was funded by the Robert Bosch Foundation. So I would like to seize the opportunity to present it here to you, and it is also the subject of my dissertation, and I'm happy to present it to you. We have heard that the prevalence of rare thousand is 5 out of 10,000 or 1 out of 2,000, and there are 6,000 of these rare diseases, and of course I'm not familiar with all of them, but for those who are affected by these diseases, it means that there are a number of burdens. Most of them are degenerative, genetic diseases, chronic diseases, and usually we know only very little about these conditions. It often takes a very long time to come to a diagnosis, and usually there is no cure for these conditions. That's why improving quality of life is one of our main objectives here, and we know that psychological and social support is important in order to improve self-management and helps people to cope with these diseases. But psychological and social support programs for people with rare conditions are very hard to find. And there are a number of reasons to this, because in addition to the burden of a chronic disease, there is an even greater strain if this is a rare disease. And usually patients are more familiar with the disease than health practitioners. And these challenges are not really taken into consideration in the number of existing programs. These rare diseases are very heterogeneous, and disease-specific programs cannot be implemented. And that's why we need cross-indication programs. Another problem is that it is very hard for many of these patients to access care services due to geographic conditions. So the objective of our program was to find out or to develop a support program for people with rare diseases and to address the issues that I've just mentioned. There were 3 steps. First of all, what we did was we carried out a needs assessment, and I would like to give you a summary of the outcome of these studies. There was a qualitative and a quantitative study. First of all, we found out that there is a high psychological strain among those who are suffering from these rare diseases, that there is a high need for psychological and social support. And in spite of the fact that it's very heterogeneous, they still have a lot in common, because people who suffer from these diseases wish to enter into touch with peers and would like to see more support in order to cope with this disease. And the qualitative studies have also illustrated that it is really a turning point as soon as they accept this disease, and this helps improve their quality of life. And it was a challenge to reach out to these patients because, as I said, these are rare diseases and they often live in very different places. And then there was the second step, and now I would like to tell you more about the program as such. There are two main programs. First of all, structured self-help based on acceptance and commitment therapy. This was due to the fact that patients said that for them it was an essential element to accept the disease in order to improve their quality of life. And then there's also telephone-based peer counseling, and we have heard that peer counseling is really important, and I found a quote from the wounded storyteller, and it runs, "I needed the insights and articulations of other people to assure myself I wasn't crazy. I needed others' thoughts to become fully aware of my own." So from the perspective of the care system, it is hard to understand the burden of patients, and from a scientific point of view, peer counseling has an important and positive impact on patients. It is not only patients who benefit from it, but peers providing the counseling also benefit from this approach. And this meets the requirement of patient empowerment. That's why we decided to develop a peer-based concept. Well, here we have a lot of information. In the next slide, on the left-hand side, you can see the self-management part, which means that patients received a self-management book with 6 chapters, and they were able to work on it alone, 1 chapter per week. And at the end of the week, there were a 30-minute telephone call with a peer counselor in order to talk about the content of the book and clarify things. And topics were based on how to deal with your disease and information, and how to navigate the internet. The second chapter was on emotions, the third chapter on acceptance, the fourth chapter was about identifying values that are important to the patient, and in the fourth chapter the goals were supposed to be defined. And on the right-hand side, you can see the consultation framework for peer counselors. They received a 2-day training at our university and a consultation guideline providing additional information to each chapter with exemplary question. And peer counselors also received supervision by a psychologist in order to receive the support they needed for this complex task. So it's a peer-based program across diagnoses, and you can carry it out everywhere, no matter where these patients live. And this is what it looks like. There is very few text, a lot of space to write down your ideas and thoughts. Then there is the third step, and we wanted to find out whether the program we developed is really helpful for our patients. We've already published this investigation, and we included 4 very rare diseases: the primary sclerosis cholangitis, then pulmonary arterial hypertony, and the Marfan syndrome, and neurofibromatosis type 1. Then, of course, the need for psychological and social support. The minimum age was 18 years old. Of course, another requirement is written consent. Then there were also exclusion criteria like a life-threatening state of health, suicidal tendencies, or severe impairments. So here we have the study design. We had 128 patients. There was also a control group with care as usual. and the intervention arm benefit from structured self-help and peer support, and we collected data at baseline, and then after 6 weeks and after a follow-up of 6 months, and then the control group also received the opportunity to take part in this study. The primary outcome was disease acceptance, but there were also secondary outcomes like health-related, life quality, self-management abilities, depression, anxiety, and we used a linear model. We were looking into the groups and the difference between follow-up data collections. So what was the outcome? First of all, we experienced what happened quite often. Instead of 128 patients, we were only able to include 89 patients with a median age of 46.3 years. 66% of them were female, and there was no difference between the groups at baseline. And here we can see the result of the primary outcome. In gray, you can see the line of the control group. Blue is the line of the intervention group, and you can see that there is improvement in both groups. However, if you look into the control group, you can see that it is not a stable development. In the intervention group, however, there is an increase in disease acceptance, and there is a significant difference between the group. Then there are also secondary outcomes where we found effects, for example, mental life quality, and a number of strategies, for example, health improving strategies, self-monitoring, and constructive attitudes, finding their way through the healthcare system, and the health impact questionnaire that we have seen before. And people felt that they received better support, and evaluation looks also very nice, because most of the patients said that they felt understood by the peer counselor, that it is important for them, that they would recommend this program. So none of them dropped out. There's a 100% completion rate. There was only a 2% loss to follow up, which was a good thing because we had only very few patients, as I said. So the bottom line is we wanted to develop a psychological and social support program for patients, and then we combined structured self-help and peer counseling. And as I said, no matter where the patients live and across different indications, there was a 2-arm randomized control trial, and it turned out that there is very high efficacy. There was disease acceptance, and it was very well accepted among patients. And what we consider to be very positive is that there was only 6 weeks with a very low threshold, and we were able to find these huge effects. And of course, we received also a number of moving letters and messages at the end of the questionnaire, thanking us and telling us that this was really a very rewarding experience, and they would love to see this to be continued. And there are 2 more things that I would like to say in the end, because we have already heard that it's often a pity that you develop new programs that are being evaluated in the framework of a research program, and then they are discontinued. So I'm very delighted to tell you that we were able to raise the funds in order to fund a follow-up program. So this can be carried out in 5 different countries in routine care, and can evaluate whether it can be implemented in Germany, Canada, Poland, Hungary, and Belgium. And we will do this with patients with rare autoimmune liver diseases, focusing on a special organ. And the project, has just been kicked off, and I'm really delighted. And I would like to thank you for your attention.